Now we have this panel starting 1 p.m. GMT. Okay, just a moment.
Yeah. So basically, we are aiming for the Martian habitat. So the main thing, if we go to the space, is like the major disadvantage is the bones get less denser. So due to the less densers, the astronauts has to be astronauts cause various troubles like bone fractures, and there are some diseases. Wolf's disease, it's called as a wolf disease. So started. So what are the problems faced by the astronauts? So the major problems is like the bones will get less denser. So the bones basically has two main core structures. One is cortical bone. The outer part is known as cortical bone, and the inner part is like a trabecular bone, the which protects the bone marrow. It's kind of a sponge thing. And the major reason why the bones get less denser is due to the two types of cells. The first thing is it's osteoclast. The osteoclast is like it is a type of cell which breaks down the bone. It removes the bones and it replaces the parts, like it's a part of replacing. And the second type of cell is osteoblast. Osteoblast is like it's in vice versa of that cell. It forms a new bone. So basically on earth the ratio of osteoclast and osteoblast will be the same. And then we'll go for the space, like osteoblast makes the new space bones. And then factors which affects the bones density, like due to low gravity, then seeking the space flight answers. So this is the basic graph where the BMD index reduces. It's like the for an average old man, it takes around 1% to 0.7%. So when the person is in space, it will take much higher. So it will be at an average of 1.5% of month decrease of density in the bone. So you can see this in the graph where it's the time lapse of 1500 days. The graph will rapidly decreasing over the period of time. Then these are the two pictures. This the picture of a normal bone, and this is a picture of osteoporotic bone. Osteoporotic bone, like this, it has been the osteoclast has been eaten the bone. So this is a picture where like you get to know like in space, like this is what happens in space. The bone gets less denser. And some other problems which will cost due to in space are renal stones, like it is due to with hyperchloremia. This is a disease which you get a lot of calcium in a urine, and there's a risk of forming a kidney stone in it. Next one is the calcium metabolism. The calcium metabolism, like there will be a loss of calcium in a bone. It would be around 0.3%. For total body, it would be around 1.5. As the calcium loses, the density of the bone will also be loose. There are two main instruments which we can avoid this kind of bone density problems. The first thing is like resistive exercise on internal resistive exercise device. So it is a device which an astronauts use to do exercises. As the stress increases on the bone, the density increases. As there is low gravity, so the bone density decreases. Due to the low gravity, osteoclast acts more than the osteoblasts. That means the bone eating cells reacts more than the bone forming cells. And in advanced resistive exercises, it's like treadmill, running, and cycling, which tells us the heart sensors also. And so, what is like bone remodeling? Bone remodeling is like the formation or destroy. I mean, the replacement of bone is called bone remodeling. So these are the, as I told, this is like osteoclast and osteoblast. So this will synthesize the bone, and this will like osteoclast will form the bone like using the bone tissues. And usually the formation of bone depends on the osteoclast. So as you see in this picture, um, like it's this is a vertebrate of a normal person, and this is a vertebrate of a person who is suffering from osteoporosis. Osteoporosis is a disease which is caused from the low density of the bones. And you can see here pictures like the red ones are the bones which are affected a lot with the, uh, I mean, lot of bone will, losses of bone will be in space. These are the, I mean, the hip part, the ribs, and the pelvis. So this is a graphical representation, like the leg will lose up to zero point 0.5, and the highest will be the FT rotch, and the pelvis, which will lose up to 1.5 percentage. So what are the factors which affect the bone in loss in low gravity are like low level of lights, as there's no sunlight, there's very little light, so vitamin D deficiency will be there. And as we are at high altitudes, CO2, high environmental of CO2 levels will be there. And there's no gravity, minimal skeletal loading will be there, and low metabolism of calcium will be there, and unloading of body weight when considering during long duration of space flight, and even the hormonal imbalance. So what are the drugs we use for the formation of bone? The one is biphosphonate. This is it's a chemical formula of like two phosphates. And this another one is melatonin. Melatonin is a chemical which releases from the brain. So melatonin is usually used for sleeping and hormonal balances. It's even used as a sleeping drug too. And the other two drugs are like Parathrome, which regulates the calcium level in the blood, and the other one is like Evenity, which reduces the causes of osteoporosis. Then supplements need to be taken is like vitamin D, dried plum, and calcium. Vitamin D is due to lack of deficiency of sunlight, so we need to take vitamin D. And dried plum is usually for avoiding the formation of kidney stones. And the calcium is generally used for the bone formation. So these are the three major elements where astronauts take bone formation. And these are the exercises, like the average time, it should be 2 hours per day. And if there is an emergency or injury, so it's not compulsory. I mean, you need not to rely on it. And the basic thing is like exercises helps us to build the bone density. The another therapy is the vibration therapy. So there are two types of vibration therapy. One is whole body vibration and low intensity vibration. Whole body vibration, it's these two vibrations are, it's like equipment which gives a vibration to the whole body. I mean, you need to stand on it, so it starts vibrating. Due to the small vibrations, the whole body will get vibrated, and like it's a kind of an exercise to the body. And similarly, it can be happen when a military aircraft is like turning at high speeds. So the g force will be more than the earth. So as the g force is more, then there are some problems which an human can face. It's like as the gravity is more, so the osteoclasts may be more. So it could be the problem of formation of more calcium in our body. So to avoid this, like, there are some basic what do you say basic techniques. And what are the major parts of our body is like which you get more strain is head, spinal cord, and the hips, where g force acts more on it. These are the factors which improves the um, bone density, is like rate of centrifugation. I mean, at how much velocity, how much acceleration you turn it, and the position, body mass, timing of exposure, and duration of exposure. And it's one more equipment like which we used in this space to exercise. So it's basically a cycling machine, so where you do cycling, and you'll get the data like your heartbeat sensors and the calories burned and everything. You'll get it on the laptop screen over there. So that's all, and thank you.